Hi everyone, thank you for joining me. Yesterday, on November the 25th, CMS announced hospital care for eligible patients in their homes and ambulatory surgical center flexibility in a press release. CMS has announced allowances for safe hospital care for eligible patients in their homes and updated staffing flexibility designed to allow ambulatory surgical centers to provide greater inpatient care when needed. These actions are aimed at allowing healthcare services to be provided outside a hospital setting while maintaining capacity to continue critical non-COVID-19 care, allowing hospitals to focus on the increased need for care stemming from public health emergency. According to the press release, the development of acute hospital care at home program was informed by extensive consultation with both academic and private sector industry leaders to ensure appropriate safeguards are in place to protect patients, and at no point will patient safety be compromised. CMS believes that treatment for more than 60 different acute conditions such as asthma, congestive heart failure, pneumonia, and chronic obstructive pulmonary disease care can be treated appropriately and safely in home settings with proper monitoring and treatment protocols. Participating hospitals will be required to have appropriate screening protocols before care at home begins to assess both medical and non-medical factors, including working utilities, assessment of physical barriers, and screenings for domestic violence concerns. Beneficiaries will only be admitted from emergency departments and inpatient hospital beds, and an in-person physician evaluation is required prior to starting care at home. A registered nurse will evaluate each patient once daily, either in person or remotely, and 2 in-person visits will occur daily by either registered nurses or mobile integrated health paramedics based on the patient's nursing plan and hospital policies. It is the patient's choice to receive these services in the home or the traditional hospital setting, and patients who do not wish to receive them in the home will not be required to. Now let's talk about regulatory flexibility for ambulatory surgical centers. As part of Hospital Without Walls program, CMS previously announced regulatory flexibility that allowed ambulatory surgical centers that normally provide same-day surgical care the ability to be temporarily certified as hospitals and provide inpatient care for longer periods than normally allowed with the appropriate staffing in place. CMS announced an update to that regulatory flexibility, clarifying participating ambulatory surgical centers need only provide 24-hour nursing services when there is actually one or more patient receiving care on site. The program change provides ambulatory surgical centers enrolled as hospitals the ability to flex up their staffing when needed and provide an important relief in communities experiencing hospital capacity constraints while not mandating nurses be present when no patients are in the ambulatory surgical centers. If you enjoyed this video, please subscribe to my channel. Thank you for stopping by. See you next time.